Hi, everyone. Welcome to another episode of Weekly Hope. It's Kirsten Hagland here, the host of this interview series. I'm here with my unofficial co-host, Elsa, my toy poodle. We are coming to you live, well, at least I'm live from Zurich, Switzerland today. And we've got a very, very special guest who I am about to introduce. But first, I wanted to take a few seconds and welcome you all. If you're joining us for the first time here, just to let you know a little bit about what we do here on this show. So we invite experts, clinicians, therapists, advocates, people with their own recovery stories, just people from a wide variety of different backgrounds and experiences within the eating disorder treatment and mental health field to come on and share their stories. Obviously, we cover a different topic every single week. And we try to cover things that are different or maybe not necessarily talked about so much, and really to try to give us all an educational experience as well as something that's enlightening and new. So with that, just want to let you know if you're tuning in and there's something that you want to hear more about, or you have a suggestion for a topic idea. Of course, always let us know. We're happy to do that and want to talk about things that are meaningful and interesting to you. So all of that said as well, this is a conversational show. Me and my guests are going to be chatting, but we want you to be a part of this as well. So as you have questions or thoughts or comments and you want to share them, please just feel free to let us know in the comments. I'll be monitoring the comments section throughout the broadcast. And I already see we've got Nikki and Deborah saying hello. Hello there. Thank you so much for joining us. And so we want to make sure that we get those questions answered, and that you have the opportunity to ask them of our incredible guests. So feel free to tune in, to say hello at any time. So without further ado, I'm going to introduce our guest and bring her onto the other side of the screen here. There's Dena, Dr. Dena Cabrera. Hello, madam.
Hello, how are you?
I am good. So I'm going to just read a little bit of your bio first so everyone gets a clue into who you are before we dive into our topic. It's funny because I've had the pleasure of knowing Dr. Dena for, probably 10 years. Yeah, I think 10 years now, from back when I feel like I was just an itty bitty baby.
Me too.
Yeah. Time does really fly. But about 10 years ago, and I got to know Dena just through starting to speak in the eating disorder community and getting my feet wet and meeting so many people. And she was one of the first that I met, and always just admired her spirit and her warmth and her genuine attitude. And it's always so wonderful when you meet therapists, clinicians, professionals who work in this field who are not only amazing at what they do, but also they're just fun people to be around. And Dena is 1,000% one of those people. So I'm really, really glad that she's here. So Dena is the executive clinical director at Rose. She's a clinical psychologist and a certified eating disorder specialist. She's personally treated hundreds of women and teens struggling with eating disorders and body image issues. She's a well-known expert, speaker, and author in the field, speaking at more than 20 national conferences and presented at more than 100 workshops on eating disorders and other mental health problems. At Rosewood, she manages the day-to-day programs for all levels of care and is involved in program development, staff training, and supervision throughout the Rosewood system. Dr. Cabrera is also the author of The Mom in the Mirror, Body Image, Beauty, and Life After Pregnancy. So that's a little bit about you. So thank you so much for joining us. And thank you for dealing with all the technology difficulties.
Thank you. Thank you for your patience.
And you are joining us from Arizona, correct?
Yes, Phoenix, okay. Arizona. We're having a little bit of a rain today, so that's nice.
Okay. Well, that is because we always know that Arizona needs rain. Yes. Just want to say, oh boy, we've got lots of people saying hello. Sarah Logan says hi. Catherine says hi from Louisiana. Deborah says self-care for the families topic. Okay, great. Thank you, Deborah, so much. We will definitely put that into the list there of topics. Thank you. We've got some good suggestions here. And Deborah Schlesinger says hi, Dr. Cabrera. Wonderful. So, okay. So first of all, before we dive in, because we're going to be talking today about ADHD and eating disorders, complications, challenges, and how to work through this. But before we do that, first, why don't you give us a little window into what you do at Rosewood?
Oh, sure. So at this point, I'm overseeing all the clinical aspects of the Rosewood system. So it allows me to go to our 3 different sites. We have one in Wickenburg, in the ranch, and then we have one in Tempe, and then we have another location in Santa Monica. So that's really fun, working with the staff, doing supervision and training, and also speaking around the country. And then I'm soon to be, in the next coming year, I'm going to be the president of Adhd, so the International Association of Eating Disorder Professionals. So that's a big endeavor. I'm really excited about it, though, and really excited to be a part of that organization. So,
yeah, absolutely. And congratulations to you on that. That really is amazing. Yeah. An amazing honor, well-deserved.
Thank you.
And I absolutely love Adhd. It's an incredible organization. I'm really, really thrilled that you're going to be in that role.
Thank you.
Yeah. So first of all, ADHD and eating disorders. This is something that you suggested as a topic area. It's something that you're very passionate about. And as I started to do a little bit more research, found a lot of articles online. We have some on eatingdisorderhope.com about this, and realized it's a lot more common than people think if they have not been exposed to it. What has your experience been? And I know that it's kind of personal for you and why you got interested in this topic specifically.
Yes, absolutely. So I have 2 children, and my youngest, who's now 14, is diagnosed with ADHD. And it took me a long time, which is a little shameful. I've worked through that, but it's a little shameful to admit, as a psychologist, really understanding and, being able to work with him with some of his, what I would say, some struggles, but some, definitely strengths that he has. But I started to see some of the characteristics in my patients with eating disorders that I, were experiencing with him. And that really led me kind of on a journey, especially as I was doing some more private practice, doing some more individual therapy with those women who had binge eating disorder, as well as bulimia and anorexia, but particularly binge eating disorder. I was seeing a lot of the same struggles, such as self-directedness, more of motivation, kind of needing things to be more of a novelty, difficulty getting organized, definitely impulsivity, but then some other factors related to food, difficulties with meal planning, difficulties with, staying on task. So I started to see some of the same characteristics, and then that led me to do some more research. And there is a lot of material out there that is showing that there is an overlap between eating disorders and ADHD.
So how does someone know if, especially if they're a clinician and someone comes into their practice or something, how do they know can an ADHD diagnosis, for example, when someone is younger, because it seems as though that is, that is the time period when parents first and teachers first start to notice these tendencies, whereas perhaps like an early diagnosis of ADHD is that a trigger for potentially developing, or could that be like a like an indication that
they could have they could have many different struggles in different areas, but definitely food could be one of them. In fact, another area that led me is there's an organization called CHAD, which is Children and Adults with ADD. And it's like a local chapter organization, and it's a support group for parents. And I was asked to speak, and they were sharing with me that a lot of their children were struggling with food regulation or, emotional regulation, and it was coming out through food. So that was another, area that I was really recognizing that, wow, this is a bigger issue than I realized. And it's very complicated because, some people think with ADHD, it's, inattention, impulsivity, and hyperactivity. And it really goes beyond that. It's really hard to understand. It's more than just, difficulty staying on task. There's executive function difficulties, so planning, organizing, needing, they could be on task 1 minute and you think, oh, wow, there's this apparent competency, they can do it. They can do it because they've done it before. But then the next time they seem to have difficulties. And that's the part that's mind-boggling. It's a disorder of inconsistency is really what I see.
Yeah, and is there, and Dena, I'm just curious about this because we believe, obviously, working in this field, that people can recover from eating disorders, that they can get to a place where, they don't suffer for the rest of their life.
Right.
Similar thing, something that with therapy, it can get to a place where it's manageable, you don't struggle with it ever again. What does that look like with ADHD?
Well, I believe I very much believe what you believe in terms of, yes, there's recovery. People can be recovered, and some people like the term cured. But with ADHD, it's a neurobiological disorder, and so it's more about managing the ADHD, finding strategies, finding techniques, ways to work around it. There is medication that can be very helpful. And of course, they have to be very much evaluated by a psychiatrist who really knows ADHD, and you really want to make sure that diagnosis is accurate before we go into some kind of medication regimen. But that's an important part of managing the ADHD as well. But I wonder sometimes, as I'm working with patients or people with eating disorders, how much of this struggle is symptoms of ADHD. And if we can work and develop those tasks and get them on the right medication, if that's right for them, then how much would that help them in the recovery of their eating disorder? And in fact, a lot of people I've worked with, that has been exactly the case. It's really helped them that we've taken the angle of working with the ADHD and then realizing that that's helped them in their eating disorder recovery.
It's so fascinating. And I was looking up some statistics as you were talking, and there have been some studies that just about prevalence, and research indicates that adolescent females with ADHD are 3.6 times more likely to develop an eating disorder, and 5.6 times more likely to develop bulimia. Of course, and it says further research yields evidence that those with ADHD most commonly manifest ED behaviors involving binge eating, purging, which you mentioned, bulimia nervosa, binge eating disorder. And one sample found that 10.4% of participants in that study with ADHD experienced an eating disorder, most commonly binge eating disorder. And I guess that would be, and does that make it a little bit easier to treat with medication, for example, because you hear so much about stimulants being used for
Right.
kids with ADHD, and stimulants can be appetite suppressants. So obviously it's not something you'd want to introduce to, for example, an anorexic patient, I would imagine.
Right, exactly. So those who do struggle with anorexia, you want to be very careful with the stimulants. Weight rehabilitation is obviously priority, medical stability is priority, and then later going back and working on the difficulties with ADHD if that diagnosis exists. It's really hard to diagnose ADHD when someone is particularly at a low body weight with anorexia. Those with binge eating disorder or bulimia, the same thing, could be malnutrition, could be, difficulties, because they're in the throes of their eating disorder, that they're having struggles with inattention, lack of focus, what all the symptoms, impulsivity, that could be part of eating disorders as well. So it's really important to tease out, looking at age before age 12. Some people's eating disorders start around that age. So it's really looking at a history. It has to be present in many different environments. And so before we look at medication, that's important. The other thing I think is important, though, that yes, when you do medicate with stimulants, it does suppress the appetite. And from a personal perspective, that's the exact scenario that's happening with my son, which made me start thinking about it. It was suppressing his appetite. And so the whole philosophy behind intuitive eating, mindfulness, I very much, raise my children with that philosophy, that attitude, that approach toward food. And now he's saying, I don't want to eat. I'm not even hungry. And I'm saying, but you need to fuel your body. You need to eat, regardless if you feel like eating or if you're hungry. And so that's kind of opposite of what, we're teaching our patients in the field. So I say that to professionals and to those who are maybe struggling with these two, is sometimes, those hunger and fullness cues are going to, first of all, the whole process of hunger, fullness cues is complicated, but it may be more complicated by medication. And the important thing is consistently fueling our body, regardless if you're on medication or not, but particularly if you're on medication and it is suppressing your appetite.
Yeah. So let's talk a little bit about stigma. We know that stigma exists with eating disorders generally, and that it's very, very difficult for people to talk about and to seek help. How did you deal with this as a parent, obviously with your son and his diagnosis? And what message do you have for parents who might have a child who is potentially dealing with this, and is struggling with stigma then on both sides of things, with both the ADHD element as well as potentially the eating disorder element?
Right, because ADHD is, in our culture, there is a lot of stigma. It's either overdiagnosed or it's underdiagnosed. And, there's lots of history with pharmaceutical companies targeting, parents with just solely using medication. And so that got a bad rap. But I certainly experienced that myself, in terms of feeling like a bad parent or a parent that was ineffective, or all the labels that you can say about, because I couldn't control him, or I was having difficulties, or I'm not following through and being consistent, or we're not having discipline. I mean, all of that I felt. And so my message is that this is a real disorder, that it looks different in many different kids, and that we as parents and just humans should come alongside people and support each other when we're feeling challenged by parenting, whether particularly in the midst of those with eating disorders and ADHD, because blaming each other and blaming ourselves certainly isn't effective, and it just continues to perpetuate the problem. We're not being problem solvers. We're just kind of sitting in this. And that's what I learned to do as soon as I started to really say, this is not about me. This is about figuring out as a family, how do we work together in helping our son, but also helping ourselves, because our mental health is the most important thing, and that's as a family. And I feel that is what we all need to focus on and make that a priority.
Yeah. Once a person does get into treatment, and whether they're an adolescent or an adult, because I have heard a couple, and these aren't personal friends, but just anecdotes from women who have gone into treatment and realized that they have, as an adult, that they have an ADHD diagnosis. And it is like, well, duh. Yes. Now I get it. Now I understand myself a little better. But what tools are, and what areas of the eating disorder in the recovery process are, how do I phrase this question? I have it in my brain, but it's like, what are the areas like that are the most helpful to work on, where like there's intersection? Is it the mindfulness? Is it the intuitive eating part? Is it the anxiety release? What areas are the most beneficial to work on and seem to provide the most fruitfulness for long-term recovery when a person is realizing this and then is like, okay, I'm going to move forward and want to work to get better?
Well, I think in working with some of my patients or clients, and then also working with my son, one thing that I've really realized is, he's a novelty seeker. He is impulsive. He does lose interest very easily. And so I really try to find, with my patients as well. I mean, this is why I think sometimes, these different diets become so interesting. They go from one diet to another because it's a novelty, and, you'll stick to it for a little while and then you'll go off of it. Now, you necessarily don't have to be ADHD. That could, be fascinating for a lot of people. But that was one of the things I thought about. But to answer your question, I think it's really knowing yourself and really calling it out what it is. And that's what we've done. That's been helpful with my son. Like, that's the challenge with ADHD. So we know that that structure is very important, but also changing things. If if working, so for example, doing his homework in the room isn't working because he's bored and he needs, other stimulation, let's try, doing something else, and, working at the library sometimes. I'm just kind of making that up. But it's the same thing with our patients. They need novelty. They need to find their passion. They need to know that, yes, they may not stick to something for very long, so we need to change it. We need to work, bring in a different skill, or bring in a different meal plan, or bring in, a different movement. For example, I know people have a difficult time staying with activity or movement, or, I don't like to use exercise, but, moving their body, because they're going to the gym and they're walking on the treadmill for 20 minutes and they've done that for 5 weeks and they're bored. So they need something different. We need to figure out different ways to help them stay interested, stay passionate, and find meaning in their recovery, and particularly with those with ADHD. So they need help with organization. They need help. How do you, let's break things up into small chunks. Let's make lists. A lot of my work, I help my patients get on bullet journals. So we make a bullet. I literally do this in session with them. I help them get organized because they have difficulties with that. So once we can start getting organized, then they can feel like they have mastery and they feel efficient in what they're working towards in their recovery. So it's a little thing like that. Help them be medication compliant. Help them maybe get on different apps. There's different apps that will help them with timelines, or help them with their meal plan, help them be accountable. So anything they can use that is fun and novelty, that would be, beneficial to them staying in their treatment and in their recovery.
Yeah, I just want to we got a couple questions and comments here. Well, first of all, Shannon says hello. We had Shannon on a couple weeks ago. Shannon Hershkowitz says supporting Dr. Cabrera from Wickenburg. Shannon's also from Rosewood. She's their rock star alumni recovery coach. And then we've got Sarah has a good question. So Sarah first says, I learned about my ADHD in residential treatment this summer, and now I have to stay mindful and be aware of myself. And Sarah, I'm so glad that you learned about that and had that discovery. That's great. She said, keeping a wholesome appetite is my challenge. And I'm not exactly sure what, Sarah, what you mean by wholesome appetite. I'm not sure, Dr. Cabrera, if you know exactly what that means, or kind of what that challenge is. Keeping a wholesome appetite, or maybe keeping an appetite is your challenge?
And that is a challenge, with all, well, not all, but many patients, people with eating disorders struggle, like I mentioned before, with hunger fullness cues. So especially those who do have some, co-occurring disorders and are taking medication, medication can interfere with their hunger fullness cues. So many things interfere with their hunger fullness cues. So, my encouragement is, hopefully the goal is that those hunger fullness cues will return, because it is hard to eat when you're not hungry, whether you're on medication or not, but the goal is to be consistent. And one of the things that I also work with, clients with eating disorders and ADHD is their circadian rhythm. It's so important to get them into a rhythm of going to sleep and waking up at the same time, eating their meals, 3 meals and 3 snacks. All of that is very important to just everything as far as your mental health and, depression, all of that, mood. It's, hunger fullness cues.
Yeah. And I think also probably probably, I'm just saying this as I listen to you talk and as I think about it, but, I think sometimes at least, and for my mind, you want to do everything right, especially in recovery, right? Once you buy in to the idea, right? Because we know that denial is a big part of the process, but once you buy in, it's like, okay, I want to be doing this right. And so then it's like, you can overanalyze the hunger fullness cue thing.
Sure.
Like, wait, how exactly am I feeling? It can get, it can get stressful. And so I think it's important to recognize too, that even living a recovered life, you're never going to be perfect in assessing your hunger and fullness cues, right? And you've been to 1,000 conferences. Sometimes they schedule lunch and dinner when you're not exactly hungry, but you're like, whatever. There's just things outside your sphere of control in life that you're not going to be able to be perfect all the time with intuitive eating. So it's also recognizing that while, yes, of course, it's so important to be mindful of that and to work on it through the recovery process and with a team of, support team of professionals, but also giving yourself the grace and understanding that, you're not going to be perfect at it all the time. You can be recovered, you can be healthy, you can be well, and, not always be eating perfectly intuitively. And I hope that kind of relieves the burden a little bit for some people too, just to know that it's just life is uncontrollable.
I think that's so much, just like what you said, to accept that part of yourself, and that's what you work on in your treatment, is that I have problems planning and organizing, preparing my meals for the day because I'm all over the place. I'm distracted. I've got a million things on my mind. It's hard for me to focus on one topic. So that about yourself. So we're going to develop compensatory, skills on how to do that instead of I'm no good, I'm not smart enough, I can't do this. Instead of blaming ourselves, it's kind of recognizing these are my strengths, these are my struggles. How can I have self-kindness and self-compassion and understand that? That's been the biggest change in my life. With working with my son is really, and him too, I can't expect him, to go to a very loud restaurant and with lots of chaos in a Friday night, 8 o'clock, that would overwhelm him and it would be not fun for the whole family. So just because I want to eat there doesn't mean, it's good for the family. So we have to I'm just giving that as an example, we have to make accommodations and be able to know what are our strengths and where do we need to modify, but that it's not about us being, again, not smart enough or stupid.
Yeah. I think that mental dialogue piece is so, so important. And I just want to get to these couple comments. Sheena Louise says journals, staying focused on hobbies, are supporting for all recovery. So journal, the bullet. Oh, I think I'm frozen. The bullet journal is really, really important. And I'm definitely one of those people. I do love making lists and I love making to-do lists. And I am definitely one of those people who, if I did something if I already did it, I'll write it on my to-do list so I can cross it off that I did it.
I do that too.
So if that works for you, more power to you. Sheena also says, food becomes a friend when you can't talk it through. Before that, she says, Sheena says, I see a dietitian for my dietary needs and goals. That's great. Also, a fitness instructor will be helpful. I'm not sure about, I know that, fitness, exercise, movement, obviously movement helpful, but food becomes a friend when you can't talk it through. Sheena, I'd love for you to more what you mean by that. So maybe we can talk through that. I don't know, Dr. Cabrera, do you have any thoughts on that? I don't know.
No, because I know that we want our relationship with food, obviously, to be, she wants to say friend. Some people are not in that place to say, well, I don't know if it's going to be my friend, but it's certainly nourishing to our body. And we want it to be a positive. We were born, that way, being nurtured, by, a breast or a bottle. And so definitely want it to be soothing to us. And we want, in our recovery, that would be the goal, is to have a really, pleasant, positive relationship with food.
Yeah, absolutely. And Sheena, if you think about it and you can tell us, maybe explain a little bit more what you mean by that, then that would be super helpful. But hopefully that it's been a good experience for you to listen to all of this. I just want to post a few more articles in the comments section here. If you guys are listening and want more information on ADHD and eating disorders, how to support someone. I guess the last question, Dena, that I have for you would be, we talked a little bit about parents and stigma, and obviously thank you so much for being so candid about your own experience with your son, and I think that's so cool. I guess my last question would be, so if you have a friend or a loved one, whether it's a family member or a friend who is in this situation where they're struggling with ADHD and an eating disorder, how best can we support them?
Well, I think the first thing is to by understanding, the different aspects of the disorders, whatever disorder it is, then we become more compassionate toward people. I think when we don't understand each other or don't understand the struggles of others, it's a little more difficult. So as we become more understanding, whether you're a professional or those struggling, even about yourself, then you can begin to have more compassion. So that's the first thing. And then the other thing is to, we've learned this in the field of eating disorder, where years ago parents were blamed, and we're really trying, starting to move, getting away from that, moving away from blame. That doesn't help anyone. So really trying to understand that that we're in this together, that it's not, these aren't made up disorders, they're real disorders. I know this for a fact. I've experienced this, even though I thought it was this, that. I mean, I used to laugh about, I have 107 excuses for why Eric does what he does, instead of really saying, this is what this is, and making excuses. He's tired, he's hungry, he's this, he's, that. It's hard for him. And instead of making excuses and blaming, it was really about understanding and accepting. I think you said it earlier. So helping someone, coming alongside of them, asking them, how can I support you? And then know that there are, like CHADD is a national organization, CHADD is a national organization that parents can get support and help. And same thing with eating disorder, learning as much as you can. Learning as much as you can, and being able to say, I think the biggest, most helpful question is, how can I support you? I'm here if you need to talk.
Yeah, that's so important, asking someone. I think sometimes we get in our head so much about, how can I help this person, when really all you have to do sometimes is ask, how can I help you? One last question here we just got from Sarah in the comment section. Sarah says, I have, and I think that's probably gastroparesis.
Probably, yes.
And it has triggered my anorexia because of the restrictions of the food and the diet on my stomach disease. How do I deal with that? What encouragement can we give to Sarah?
Well, that is a big, huge issue and a very real issue. And there are doctors. It would be really great if you could get to a doctor who does know something about eating disorders, because the two can go hand in hand. Dr. Jennifer Gaudiani just wrote this amazing book. She's at the Gaudiani Clinic, and it's called Sick Enough, and she talks about gastroparesis in there. I'm not saying that you do your own diagnosis and your own treatment, particularly from a medical standpoint, but you can learn more about it and hopefully find a doctor and a nutritionist that knows about eating disorders and can help you with this.
Yeah, absolutely. And Sarah, thanks for signing on. And I know you've been on here before, and so just want to say thank you and welcome back. And also, we've had Dr. Gaudiani on the show, and she's awesome. And I am going to put a link to her book, because that is a great idea, in the comments section as well. One moment, I'm going to put it here, the Amazon link to buy, if you guys want to check it out.
It's really, of course, I love her and I'm impressed with her, because it's written where we as lay people, and I consider myself, we can understand it. Some other books on, medical complications of eating disorders are so medically written and really real. So I love it.
Yes, absolutely. And I think Sarah just said Sick Enough is the book, and yes, that is the name of the book, Sick Enough. And I just put the link down there. And then, all right, one more question here, Dena. Sheena, 15 years, childhood image issues, and a rough upbringing. A recent incident became a trigger to depression and binging, purging. So it looks like, yeah. Thank you so much for being so open, Sheena. Really appreciate that. I would just encourage you, if you don't have a treatment team or someone that you're able to talk to, that you seek that out, because this is this serious issues, and obviously, as you mentioned, it's there's so many factors that come into this. And so first of all, I want to say thank you so much for being here, and I'm really, really glad you are. But I really hope that you have a treatment team, and if not, that you seek one out, because you don't have to struggle with these things for the rest of your life. You can get better, and recovery is possible. Even if it's been intermittent for years, like full recovery is possible. And so I just encourage you to take this to the next level and to seek treatment if you have not already.
Yes.
I got Sarah says, thank you so much. Yeah, you're welcome. Thank you so much. Cool. Well, Dr. Cabrera, thank you so much. You have been such a joy, and thank you again for sticking around and with all of the live craziness. But I'm really
determination, right?
the trials, yeah. But I'm really glad that you did, obviously, because this was a great conversation, and I know very, very helpful for our viewers, and really glad that we were able to illuminate and shine a light on this issue a little bit. So thank you so much.
Thank you for having me.
Yeah, absolutely. Well, we're going to say goodbye to Dena, and I'm just going to say goodbye to all of you. It's Friday. Happy Friday. Hope you have wonderful plans for the weekend. Thank you so much for joining us for another episode of Weekly Hope. I hope that this was inspiring and educational for you. And I know that we usually have a lot of people watching who are currently, in the middle of something and reaching out. And Sheena just says, I'm under a doctor's care. Thank you for reaching and reading. Yeah, good, Sheena, good. That's awesome. And just want to say, thank you so much for coming on here and offering your comments and questions and your honesty and your vulnerability. It's amazing. But just want to encourage you, if you are in this process, that there is hope, that people do get better and they go on to live healthy, full, productive lives. And you can too. You absolutely can. And so I just want to encourage you to keep going, even when it's hard, even on days when you feel like you can't do this one more second, you can. So we believe in you. We're here for you. And yeah, just you're in our thoughts and prayers. So, all right, have a beautiful, wonderful Friday. Have a good weekend. And make sure you check in to our Facebook page, Instagram, Twitter, etc., to catch the next episode of Weekly Hope. It's going to be next Wednesday. We'll let you know about our guest and our topic soon. So thank you guys so much for tuning in. Have a great weekend, and we will see you next week. Ciao.